Everybody knows somebody who has had this surgery. And you ask them and you say, have them give me, if they feel comfortable, would you have them give me a call? Could I call them to find out what their experience was? And so you start gathering information, personal experience of other people, both good and bad. And where I worked, there had been a couple men that had had the surgery. One, it did not turn out well at all. And so I asked him, who was the doctor? What went wrong? And he was able to share with me, here's some of the things I wish we would have thought about before. The cancer has been there for a while. It's going to be there for a while longer. Take time so that you're familiar and you're comfortable with the course of action that you plan for yourself. The first doctor I talked to was talking, he'd done 150 to 200 procedures. And he felt very confident that that was enough that he had seen, and that, by the time you've done one thing 200 times, you know what you're doing. And when I talked with Dr. Lepor, he's approaching 4,000 at the Smilow Center. I looked at my wife and I said, well, you know what? What he does better than anyone else. If he does the procedure with a chainsaw, I want him in there doing it with a chainsaw because he's going to do it better than anyone else. Fortunately for me, he doesn't do it with a chainsaw. He uses much more delicate tools. But he's the man. There's an area of the prostate that it was close to 40% cancerous cells. And it would never have shown up on a biopsy. Dr. Lepor was, I don't want to use the word surprised, but it was interesting to him that nobody had picked this up. And he said, the technology that we have now with a biopsy, he said, we don't go into that area. It's just too dangerous. It would have never showed up. If I had gone to this doctor who had done the 200, if he saw this 40% growth that they weren't expecting, would he have seen that before? Would he have seen it as many times as Dr. Lepor had seen it? Dr. Lepor, when we were going over his notes today, he said, I got this 40%, and I thought, yep, that's what we need to do is take this next one down, take a little sample from that, see if that one's clean. It was clean, we put that up, off and we're gone. It wasn't even a problem. The term that comes to my mind is it was just a really well-oiled machine. I was not the first one to ever come through. The doctors, all the doctors that work with me, the nurses, the hospital, the checking in, checking out, the people that you work with, that are trying to get things ready. Every one of them had a job to do, knew their job, and were extremely professional in doing that job.